It is 8:15 now, Thursday morning, December 10th, 15 days till Christmas. According to the CDC, chronic pain affects approximately 50 million U.S. adults and is one of the most common reasons adults seek medical care. Our friend Dr. Brent Wallis from People's Health joins us now to discuss the different types of pain and when it's best to see a doctor to help manage it. Morning, Dr. B. How are you?
Hey, Tommy, I'm doing well. How about you?
I'm well. Somebody has already thanked us on the text line, or thanked you actually, for taking up this topic because they know it's very important. Chronic pain can be a very vague term, though. How do you describe it?
Yeah, so pain is a very big problem, and a lot of people suffer with it. But pain itself is really just a symptom of either an injury or illness, and we classify it as either acute or chronic. And acute pain is really sudden pain that we really experience because something has happened acutely. It's a signal that the body is saying, stop doing what you're doing so that the body can start to heal. Chronic pain is a little bit different. Chronic pain is something that lasts for longer than 3 months, and it really tells us that there's a continuing injury or an illness that really needs to be addressed. And there are actually 7 different types of chronic pain, and I can kind of run through those quickly. But the first one is something we call somatic pain. Somatic pain is pain from skin and muscles. Usually it goes away in a short period of time, and over-the-counter medicines can really help. Anti-inflammatories can help that. And an example would be back pain or fibromyalgia. Visceral pain is pain that comes from internal organs, and so that can be something like an upset stomach or even could be a sign of an appendicitis, something that you need to address right away. Another one is muscle spasms, and this is very common. It can be caused by dehydration. Most people call those Charlie horses, and so those can be addressed a little bit quicker just by drinking a lot of fluid. Bone pain is the 4th type, and that's pain that you actually feel from your bones. It's the nerve endings that are in your bones, and that can be from a fracture or any sort of bruising of the bone. It can be related to arthritis, or sometimes more seriously, something like a bone cancer or cancer that's spread into your bones. So that's always something that you want to get addressed by your doctor right away. And then the 5th type is headaches. Headaches, everybody's familiar with. That can be migraines, tension headaches, or something like sinusitis, which is very common here in Louisiana. And then the 6th type is circulatory problems or vascular problems. That's where there's not enough blood supply to an area, and that can cause chronic conditions, pain, especially in your lower extremities. And that's exacerbated by smoking, which is why we always say stop smoking. Because it can lead to a lot of problems. And then the last type is something called neuropathy. And neuropathy is usually peripheral, which means that it actually happens along the pathways of your longest nerves, and that can lead to pain all over the body. But in particular, diabetics, for example, can sense that in their feet. So you can tell there's a lot of different types of chronic pain, which is why it's a problem that a lot of people suffer from and something you really need to understand so you know how to treat it.
And it all makes perfect sense, and I guess that's part of the diagnostic procedure because, your leg hurts, you don't know what it is. You don't know if it's bones, you don't know if it's circulatory, you don't know if it's nerves, what have you. How do you know, Doc, when you should go to see a doctor?
Well, it's common for people to have minor aches and pains, especially after you've hurt yourself. What's not normal, though, is pain that really doesn't go away after a period of time. Anytime you have numbness or tingling, especially in your extremities, that can be a sign of something worse going on. Also, pain associated with fever or weight loss is never normal. And then the other one that I kind of watch for is inability to urinate, especially in men, because that can be a sign of prostate cancers and other bladder problems, or losing your urine can actually be a similar problem. So again, those are all signs that really tell you need to go talk to your doctor about this.
All right, let's let what we've heard so far settle in, and we'll digest that. And when we come back, we'll talk about pain measurement. 8:19 now, time for traffic. More with Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. And we come back as we talk about chronic pain and how to manage it. Right now, we pause for traffic, WWL. 824 here at WWL, talking to Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health, as we talk about senior health on Thursday mornings. And today we're talking about chronic pain. We've already gone through the different types, and I would suggest you download the radio.com app, because you'll be able to rewind with that feature and listen to the whole thing. So, Dr. B, how do you measure pain?
Yeah, we use a couple of different ways to measure it, but probably the one people are most familiar with is a simple pain scale, and that's where we have a scale from 1 to 10, and we ask you what number of pain you're having, 1 being mild pain and 10 really being unbearable. There's also a pain ladder that was developed by the World Health Organization that classifies pain into mild, moderate, and severe. And mild pain is really pain that usually goes away on its own, sometimes without any therapy or just by using simple over-the-counter medications. Moderate pain really does limit your function and the things that you can do, and it requires treatment, sometimes stronger pain medication, prescribed by your doctor. And then the last type being really severe pain, which interferes with all activities, makes it tough to really get up and go every day. And that type of pain really needs to be addressed. It may require stronger pain medication, and in limited instances, that can even include opioid-type medications. I think the really important thing about pain measurement is that you should be truthful with your doctor about it. Everybody's perception of pain is a little bit different, but your perception is important because it can be compared from visit to visit, so we can see if we're actually doing something to make you feel better.
You don't want to go with the kill a gnat with a boulder approach, and it hurts a little bit, so throw everything at it, because that can cause some other problems, right, including addiction and some other complications. How serious is that?
Exactly. I mean, addiction is very, very serious. It's been in the news a lot for the last couple of years, but it's really been around for forever. And dependence on these opioid-type medications can be very severe. There are a lot of complications that are associated with that type of medicine. One of the most severe can be constipation. The medicines actually slow transit through your bowel, and so it can make it very difficult to have a bowel movement. For our seniors, though, I really worry a lot because opioids can cause dizziness or sleepiness, and that can result in, car accidents if they're still driving. You definitely should not operate any large machinery, and you definitely shouldn't drink alcohol if you're taking any of that type of pain medication. And then one of the other problems we see with that type of medication is nausea and vomiting. That usually can go away after a couple of days, but again, you have to be under close physician supervision if you're going to be taking that type of medication. And a lot of times there are non-prescription medications or things that are not quite as strong that can help your pain as well.
I would imagine nobody likes to be in pain. That can be fairly depressing.
Yeah, extremely, and pain can cause depression, but depression can actually worsen pain as well. It's estimated that probably about 60% of people with chronic pain also have depression. And interestingly, we use antidepressant-type medications sometimes to treat pain. And again, like I said, pain is a perception, and so if you feel worse, if you're depressed, then your pain is going to be more severe. If we can treat your depression, then sometimes the pain is more tolerable, and on that scale you would rate it a little bit lower. So that's why it's really important to address that issue as well, because that can sometimes solve some of the problems that you have with chronic pain.
Sleeping with chronic pain can be difficult. How do you manage that, and what can you do to kind of promote a good night's sleep?
Yeah, that's another very difficult problem, and we do not like to use sleep aids wherever possible. So what we tell people is, avoid some things right before bed that can keep you awake. That includes caffeine. Exercising too close to bedtime actually increases your endorphins and will keep you awake. Definitely eating too much or eating spicy foods can keep you awake as well. And then drinking alcohol and smoking close to bedtime really alters your sleep pattern. And so that's something we don't recommend either. So really some of the things I tell people they can do, take a warm bath before bed. Sometimes that makes you feel better, relaxes you, and helps you sleep. Exercise earlier in the day, because we definitely want you to exercise and stretch out those muscles, but just don't do it right before bed. And then another big thing is try not to watch TV or play on your phone too close to bedtime. The light that you get from television and your telephone can actually cause some problems with your sleep cycles. So you really need to have a nice, dark, cool environment. Make sure that your pillows are good and everything so that you can get a real nice, restful sleep, because that'll make you feel better the next day.
Doc, I can't tell you how much we appreciate you coming on. You help a lot of people, and we enjoy talking to you. You can find out more at peopleshealth.com, 855-821-2666. You can follow People's Health on Facebook, Twitter, and Instagram. Dr. B, have a great weekend, all right?
Thanks, Tommy. You too.
All right, 8:30, time for WWL First News. For that, we go to Dave Cohen.